Pulses of the extraordinary vessels, exploring pulse qualities of the extraordinary vessels based on historical texts and their clinical implications. The extraordinary vessels are critical pathways in TCM that govern the flow of qi and blood throughout the body. They play a vital role in pulse diagnosis, providing insights into the health and balance of the body's organ systems through specific pulse qualities associated with these vessels. Historical context, Mai Ting and Li Shi Chen. A timeline highlighting the key contributions to the understanding of extraordinary vessels in TCM. The Pulse Classic, Mai Ting, is authored, providing foundational insights on pulse qualities related to extraordinary vessels and their pathologies in 80 to 180. 16th century, Li Shi-chen compiles and expands upon the teachings of the Mai Ting in his work, A Study of the Extraordinary Vessels, further detailing pulse qualities and their clinical implications. Pulse qualities in Mai Ting. The pulse quality described as wiry indicates pathology of the yang chow mai when both tune positions are affected. This quality is interpreted as resembling a pellet or bullet, suggesting a tight and spring-like quality in the pulse. When the quan positions are wiry, it indicates a pathology of the tai mai. This quality suggests strong tension in the middle pulse area, reflecting potential blockages or disturbances in the tai mai pathway. The yin chow mai pathology is indicated when both shear positions exhibit a wiry quality. This reflects underlying issues within the yin chow mai vessel, typically linked to the body's balance and energy flow. The wiry pulse quality referred to as tan in the Mai Ting signifies specific pathologies related to the extraordinary vessels. Characterized by a sensation akin to a pellet or bullet, this pulse exhibits a firmness and a tendency to spring upwards, indicating potential imbalances in the yang chow mai, tai mai, and yin chow mai. Pathologies indicated by pulse qualities. Understanding the specific pulse qualities associated with the extraordinary vessels can provide insights into underlying pathologies. Wiry pulse in both positions denotes a disturbance in the yang chow mai, reflecting issues related to movement and coordination. Wiry pulse in both quan positions indicates pathology within the tai mai, often associated with the body's lateral balance and structural integrity. Wiry pulse in both shear positions signifies a problem with the yin chow mai, which can affect rest and restorative processes. Firm pulse across all positions suggests a strong, unyielding energy flow, indicating potential issues with the chong mai and related menstrual or reproductive health. Floating pulse characteristics through all positions signify fluctuations in the tu mai, often relating to the central nervous system and vitality. Detailed analysis of the pulse positions. Key pulse qualities reflecting pathologies of the extraordinary vessels. Firm pulse from qi to tun indicates chong mai pathology. Hard and full pulse in middle positions indicates chong mai. Floating pulse from shi to chun indicates tu mai. Wiry pulse in both tun positions indicates yang chow mai. Wiry pulse in both quan positions indicates tai mai. Wiry pulse in both shear positions indicates yin chow mai. Tight, fine, full, and long pulse in middle positions indicates ren mai. Like pellets felt horizontally on both tune positions indicates ren mai. Firm pulse across all positions indicates chong mai. Floating in all three positions indicates tu mai. The 9 areas of pulse reading, understanding the correlation between pulse positions and organ qi as outlined in the Mai Ting. Front position, left, represents the qi of the heart and lung. Front position, right, corresponds to the qi of the lung and large intestine. Middle position, left, indicates the qi of the liver and spleen. Middle position, right, reflects the qi of the spleen and stomach. Rear position left associated with the qi of the kidney and bladder. Rear position right connected to the qi of the bladder and kidney. Lateral area, all positions, enhances understanding of the overall balance of yang and yin. Central area, all positions, focuses on the core vitality and strength of the organs, qi. Medial area, all positions, provides insight into the deeper internal functions and pathologies. Summary of extraordinary vessel pulses. Yang Chao Mai, wiry pulses. Tai Mai, wiry in the middle. Yin Chao Mai, wiry in rear. Chong Mai, firm pulse. Tu Mai, floating pulse. Comparative analysis. Mai Ting versus Li Shi Chen. In the minding, the pulse qualities for the extraordinary vessels are defined through the specific positions of the pulse and their characteristics. For example, the wiry pulse in the Tsum positions indicates the Yang Chao Mai, while the same quality in Quan position suggests the Tai Mai. The minding provides a framework for understanding how different pulse qualities correlate with pathologies, notably emphasizing the role of the pulse's firmness and floating nature in diagnosing the Chong and Tu Mai. Li Shichen expands upon the pulse qualities described in the Mai-Tsing by introducing additional nuances. For instance, he notes that the Renmai exhibits a long, tight, and fine pulse from the front to the middle positions. He also confirms the floating nature of the Tumai in all positions and highlights that both the Ying Chao, Yang Chao, and Tai Mai maintain their wiry characteristics. Li Shichen's interpretation allows for a more comprehensive understanding of the pulse dynamics, incorporating the complexity of pulse readings and their implication for diagnosis. The study of pulse qualities in the extraordinary vessels provides practitioners with essential diagnostic tools that enhance understanding of underlying pathologies. By recognizing specific pulse characteristics, clinicians can tailor their treatments, leading to more effective patient care and holistic healing.